you all for joining us this afternoon. That was a clip from Critical Condition, Health in Black America. My name is Valerie Scoon, and I was a producer on the film. And for our panel today, we are joined by Dr. Veronica Gillispie-Bell, who is a professor of obstetrics and gynecology at Ochsner Health in New Orleans, Louisiana. We're also joined by Dr. Heather Skanes, who is the founder and executive director of Oasis Women's Health and Oasis Family Birthing Center in Birmingham, Alabama. And we are also joined by Frazier, an educational entrepreneur and the mother seen in the film in the Oasis Family Birthing Center. Thank you all. So before we get started, I just want to let the attendees know that they can use the closed caption, which is usually at the bottom of the Zoom. And also for any questions you might have, you can put that in the Q&A in the Zoom, as we'll have a sort of question section towards the end of the program. All right, so I think we're going to start out with the first question, which each of you can answer, which is basically, why, you're all very busy, women and professionals, and, it takes time to sort of participate in a film. So the question is, why was it important for you? And I guess I'll start with you, Dr. Gillespie. Why was it important for you to participate in this film?
First of all, thank you all for having me here today. It was crucial for me to participate for the reason that the film was created. We have disparities in the Black community, and as much as I have done education-wise across the country on health equity, that race is a social construct and not a biological condition, there is still such a bias that is built into the healthcare system that as Black individuals, there is something biologically different, and that is why we are having these health outcomes. So, whatever platform I have available to me to use, I am always trying to use that for education, one, to understand the history, understand where we've been so that we can know where we need to go to improve these outcomes. And again, to just highlight that the fact that these disparities, and it doesn't matter if we're talking about disparities for maternal health conditions, or if we're talking for disparities that are more in the primary care population, that these disparities will always boil down to structural racism that affect our social determinants of health and implicit bias. And so again, whatever platform I can use, I am always there for it.
Okay, and Dr. Skanes, how about you? Why was it important for you to participate in this film?
Well, I think definitely similar reasons as Dr. Bell. But in addition to that, I really wanted to shed light on what has been happening here in Alabama. Alabama, in particular, like other states in the Deep South, have been even more affected than other parts of the United States. So I'm always excited when we get an opportunity to shed light on the issues that we have, just so that people who can help are able to help. But then I also was excited because it's not just showing the problem, but things that we are doing here to bring about change. Because sometimes I think that we have a narrow stereotype of Southerners, and we just think that everyone, like, no one's doing anything, but we are. There's a big grassroots effort here. So I was very excited to show how much work has been done here.
And Kai, I think you had a really unique contribution to the film in that you, invited the filmmakers into one of the most important days of your life, I'm sure, um, giving birth to your son. So, um, can you tell us why you agreed to this and why you thought it was so important to participate in the film in this manner?
Of course, and thank you for having me again. But I'm glad you brought that up because I was hesitant to participate because I would be showing one of the most intimate moments of my life, also a first-time birth, so I did not know what to expect. However, I know how important the work is that it's being done across the world, across the country, and especially in Alabama. And I had to put those feelings aside. I support Dr. Skanes in her work, and I hope it grows. And I know being a part of this was a contribution to the movement that's happening.
Right. So, you all are obviously really aware of the issue with maternal health and the mortality rate. What what do you hope that this film will allow, other people to know? Like, who are these other people, and how will it help everything for them to know? I think that, Black women are often aware of this on some level, whether they understand specifically or generally, certainly they've heard, and I think something about it. And I think it's impacting the younger generation women even being fearful. But what would you hope for this film to do?
I think for me, yes, I want Black women to be aware, but as you mentioned, I think there's been a fair amount of media coverage. Black women are aware of these disparities. So I think more importantly, that health professionals, as well as policymakers, are able to use this film to understand what the drivers of maternal mortality are, especially in the Black community, so that we can start to implement solutions like Dr. Skanes is using in Alabama, and really those solutions that center our patients, that center the voices of Black women, understanding why we don't center the voices of Black women, where that comes from, so that we understand the stereotypes that we have put on Black women. And so that we as health professionals just check ourselves and understand if I am assigning a certain description to this patient that's in front of me, this may be a bias, and I need to understand where that comes from so that I can undo that bias. But again, on the part of policymakers, so that they understand what policies need to be put into place so that we have improved access to all of the things that drive our health outcomes. And I think that this film is extremely important right now in a time when there is a movement on the federal side to not talk about the blemish of slavery, of Jim Crow, of what has happened in this country that has formed these biases. And so I think it's important to have films like this to be able to continue to tell that story and to concentrate on the history.
Hmm. Yes, and just to follow up, I also think it's one of the challenges also not to blame the patient, and maybe you can speak to that, Dr. Skanes, or to blame Black women in general.
Right. And I think that's why the history is so important. I think that when people come to me, in general, they will say that they know that they have worse outcomes. But the first question is always, well, why? And I think specifically here in Alabama, because if you look at the foundation of gynecology, begins here in Alabama, begins in racism, and is spread throughout the country. It's important for people to understand that history and why it's particularly bad here in Alabama, like why we're the worst. This started here. This is a disease kind of that we have spread the way that women are treated. I think that's critical for people to understand, like Dr. Bell said, so that we can begin to undo that process, but also so that we can begin to recognize these things in our daily lives. For example, some of these things we were taught in medical school. We were taught that this Black women are this, or Black men are more likely this, and it's not necessarily true. And we've started to see some of those things become undone, but it's very important that we realize this is not a long time ago. Some of these things have pervaded even into recent education, even to recent textbooks, even into recent practice of medicine. And so that we can start to recognize it in real time and bring about those. Well, if you're doing something differently because I'm Black, maybe we should consider something else. Maybe we should consider giving me the standard of care. And I think that's an empowering thing for patients to understand.
Yes, and I think that can sort of help to lead us into the next clip, because one of the things you're talking about is, the biases, having people being treated differently when they show up at the doctor's office, and whether it's their pain threshold, for Black people having a supposedly higher pain threshold, can impact. But I think that one of the things it also shows that the film talks about is that that Black women, that wealth does not help you escape this problem. And so I think that the next clip will help us, open up that conversation. So if you mind playing the next clip for us. Okay, well, thank you. I think the to sort of pick up where we were having the conversation before the clip, but this kind of allows us to maybe do a bit of a deeper dive. Perhaps I'll start with you, Dr. Skanes. Like, if we could sort of enumerate like why is this happening? You said that this is what people come in, they ask you why. And so we see in this clip that wealth does not protect you from it. So could you go through some of the sort of reasons why you think specifically this is happening? Both the biases as well as the practices.
Yeah, I think that it's a number of things. I think it's definitely multifactorial. Some of the things that we see or that I see, one is access to care. So sometimes people are getting care later than normal. Um, Really, right now, one of the biggest things I see is people don't feel comfortable with the providers. So that is a huge deterrent from seeking care early. Because they're like, I don't want to go to any of these hospitals. I don't like any of the providers. I don't like any of the options that I have for me. So that's a huge thing. I think sometimes people will go to the hospitals and either they've been mistreated or they've had family that's been mistreated. And so, you feel less comfortable telling everything that has occurred or your concerns. You're not feeling like you can really express yourself. And then I've also seen people who have expressed themselves and they've said, hey, my blood pressure is high. I think I have this. And they're just flat out ignored. The tests aren't done. The provider thinks, well, I don't think you have that. I think your blood pressure is high because you're in pain or, whatever. And so I think it's a number of reasons, but I do think it all comes down to people, women of color, feeling mistreated and actually being mistreated. So the fear of being mistreated also affects us.
So Kai, I know we're going to talk a little bit later more about your actual birth, but you know, um, before just during your pregnancy, how much did this play upon you, this concern, either before you got pregnant or while you're pregnant about the health, your health and your baby's health?
Absolutely. When I thought about being pregnant, I never thought about being pregnant in Alabama. And to be honest, Alabama was no way in my path. I ended up here through work, and the time aligned that it was time for us to go to family planning. So I never even thought of conditions such as Alabama. I always thought I would have choices of different types of birth I wanted and having teens and having a joyful pregnancy. And immediately, all of that changed. And it didn't take, a long Google search to see what I was up against when it came to childbirth in Alabama. So with all of that, though, I am very fortunate that I did do the work to do the research, to be very intentional about finding that care. I would go to every Black person I saw and said, who delivered your baby? If I saw them being pregnant on the street, I would say, who are you talking to? What is your plan? And I would learn so much. The other thing I didn't expect is even knowing all of that you can find on Google, I wasn't prepared for the news of a lot of the labor and delivery wards closing. So if people told me they had a trusted place they went to, I would find out it's no longer there or it just closed or they don't know the future. Even when I found Dr. Skanes, we were hoping, I always wanted to have a birth in a birthing center. I never, ever imagined a day of my life having a birth in a hospital. So when I came to Dr. Skanes and I had researched and I saw the work she was doing, I got excited. And then I think, I don't know when it came, or maybe about 3 months before my pregnancy, she was able to open the birthing center. So even knowing hope was there, it still wasn't certain that I would be able to have that experience. So we were actually planning for a home birth. So
Right.
it just took a lot of intentionality to get to the point where we were. And I wanted to do the film because I hope that as a community, we can start to envision different as possible, lean on that community. And I hope that efforts like this really start to make a change.
Yeah, well, thank you. I mean, I think that you did show a lot of intentionality, and I think that for a lot of women, which is, I mean, which is a wonderful thing for that I'm glad you had that, and I think that what you were talking about, Dr. Skanes, of people, not being heard or not being listened to. Obviously, Kai, you were trying to address that, but I guess I wanted to address this next question to Dr. Gillespie about, what is it, and you mentioned some of this, Dr. Skanes, too, about your high blood pressure or your pain, and how to specifically can this sort of lead to poor outcomes if somebody's misinterpreting, if they think that Black people have different biological responses.
Yeah, it can manifest in a number of different ways, or the consequences can be different depending on the situation, and they can be severe. In my situation, and I talked about it in the film, I was out of town at a conference. I went to a hospital that was where I was just another Black woman coming into the hospital, and I told them I thought I was contracting, and they did not do the evaluation that would have normally happened for someone that you're trying to rule out preterm labor for. Thank goodness when I got home, I was able to be evaluated by one of the physicians that I work with, who said that something is not right, and she was right. Your cervix is supposed to be 25 millimeters. Mine was down to 9. And I was contracting, and so we did everything we could to try to keep my son in, and it worked. I made it to 35 weeks and 6 days, but had that physician not said, wait a minute, something is not right, I hear you, then I probably would have delivered it at 25, 26 weeks, which would have meant a preterm birth. As was mentioned in the film, Black women have a higher rate of preterm birth. We also have a higher rate of infant mortality, and that could have been my consequence. For Serena Williams, she had a blood clot in her lungs that has a high mortality rate. And so, had she not advocated, and reading her story, I mean, she vehemently advocated for a CT scan that eventually they were able to find that blood clot. If that had not happened, she could have died. And then many of us know the story of Kira Johnson, Charles Johnson's wife, where she was not heard, and she and he were saying something's not right. She's hypotensive, something's going on, and she was ignored. Care was delayed, and it did result in death. She bled to death. So these consequences are severe. And just to highlight just one more thing about these disparities, so a Black woman with a college degree is twice as likely as a white woman with an eighth grade education to experience a pregnancy related death. And that is how we know that it's not just socioeconomic factors, that it is bias, and the bias is causing us to not have the same quality of care, and that's what's contributing to these disparities.
Yes, and I think and part of what you're talking about with all of these people is uh, part of it is not being listened to, right? So part of it is that the patients are coming in perhaps with some complaints, and either they are being misinterpreted, like it's okay for them to have a high blood pressure, but really they're veering towards eclampsia or preeclampsia. And I think that's a word that people often learn too late, So what is it, I guess, Dr. Skanes, in terms of helping medical professionals recognize that, Black women don't naturally always have high blood pressure, or pregnant women, how can they sort of be more attuned to alerting patients into eclampsia or preeclampsia concerns?
Well, I think that this is one of those things that we as a community have to educate ourselves about. What is a normal blood pressure? And advocating for yourself when you know it's not normal. It's kind of unfortunate, but you know, having a chance to see other hospitals, and see how things are work. Sometimes I'm surprised when you inherit a patient and you see, and like, nobody thought to do a preeclampsia workout. We're about to send this lady home, and we didn't even just do the simple labs before sending her home. And so I think this is one of those things that you as a patient can advocate for. I think, for us, as a woman in general, if you're pregnant postpartum, if your blood pressure is greater than 140 on top, greater than 90 on the bottom, you need to be asking for a preeclampsia workup. And I would not leave until I get that. I think that is something that's very easy for us to do and take ownership of, because we can't expect, unfortunately, at this point, for anybody to save us. You as somebody in the community, whether you're having children or not, somebody who's going to have a baby or who may be pregnant currently, you can advocate for that for them. Hey, I know this isn't a normal blood pressure. Can you evaluate her for this? Can you show me where you evaluated her for this? And I think this is something we cannot let up on, because this is one of the biggest causes of maternal morbidity and mortality that we see in the United States and across the world. And I think we can do these things. This is something that we can do. This is something that we can take ownership for. Even in the birthing center, we're screening people for preeclampsia every single visit. We don't want anybody with preeclampsia to be in the birthing center. We want people to be in the hospital. And so at all levels of care, this is something that we can do.
And I wanted to take a moment and see if one of you could define or explain preeclampsia. I think I just jumped in and used the phrase, but I just want to make sure everybody understands, what we're talking about here.
Right. So preeclampsia is a blood pressure condition that typically develops after 20 weeks of the pregnancy. And it's typically identified by changes in protein within the urine, along with other symptoms. Some other labs can be abnormal, your kidney function, your liver function. People will sometimes have swelling in their legs, throughout their body. There's a number of other symptoms, and it can progress to what's called eclampsia. And that's typically when we would start to see seizures in the pregnancy, and that can lead to death. And preeclampsia is something that's considered a significant event in pregnancy, and it always requires some sort of intervention.
Okay. So, you were advocating for women to advocate for themselves and, in terms of their pressure when they go to the doctor's office. What do you think in a larger sort of a larger sense, even outside of the woman in the office needs to happen for, these expectant mothers, like Kai was, a year ago, to be heard? Like what has to happen in terms of the medical schools, the medical the profession. What would need to happen, do you think, Dr. Gillespie?
Yeah, I think there's a number of things. One, we need more Black providers. Black physicians represent about 5% of active physicians. About 6% of active physicians are Hispanic. So we do not have enough physicians of color. So we need more initiatives to help increase that number. One of the things that I'm involved with, I'm on the board for the Xavier Ochsner College of Medicine. So my hospital and my alma mater, we're working together to establish a medical school specifically so that we can have a more diverse physician body in the Gulf South region. For those that are listening and that don't know, I'm located in Louisiana. So that is one initiative. And so we need more initiatives like that where we are really partnering with our historically Black colleges and universities, our historically Black medical schools, so that we can see more providers that look like the patients that we serve. That's one thing. And then we have to continue educating, and films like Critical Condition that does help to educate our providers to just create awareness. I do health equity lectures all over the country about these disparities and where they come from. And there is a light bulb that goes off. I cannot believe when I'm in spaces and I will always ask people to raise their hand and say, well, who in here has heard of Dr. Marion Sims? And I think everybody's hand is going to go up. And it's still only 2 to 3 people in the room have even heard of Marion Sims and the atrocity that he has caused. And we know how that has impacted our outcomes. And so we have to keep educating. We have to be in spaces where we can continue to get that education out. And again, we have to continue to improve the diversity of providers. We have to also, when I say improve the diversity of providers, not just in terms of Black providers and Hispanic providers and providers of color, but also types of providers. We are the only high income country that has the maternal mortality rates that we do. We have the worst of all high income countries. If you look at those same high income countries, among many other things, they have a higher uptake of midwives, where they have more midwives than they do OBGYNs. On average, in high income countries, 30 to 40 deliveries per 1,000 births are attended by midwives. In the US, is 4. And so we have to look at different ways that we are providing care and the types of providers that are providing that care.
Well, that's going to give us a really good intro into the next clip, which will introduce us to the Oasis Family Birthing Center, and we'll get to hear more or see more about Kai's experience there, and then we'll continue on with our conversation. So, with that, do you mind playing the clip? Thank you again for Kai for sharing your beautiful birth moment with all of us, or time with all of us, and the film, and again here. Um, so I guess I want to start with you and talk about your journey, to Oasis. And you earlier you talked about your intentionality about your birth. So can you talk to me just a little bit more about like how, why, you didn't seem to be thinking about a hospital, necessarily for your birth. It seems like you always wanted to go to a birthing center. Can you tell us a little bit more about why that was for you?
Sure. I think that everybody should want the odds to be in their favor. And I felt like when I looked at hospitals, my odds weren't as good as other options. So it wasn't even a question. It was simple logic. Hospitals are not where I desired to give birth. If I have to, if something happens, okay, fantastic. But if not, I don't want that to be where I'm starting my planning. So even with that mindset, I just thought I would have different options. So when I got to Alabama and realized that we don't even know if I'll have that option, period, to have a at home or a birthing center birth. That was very, once I just wasn't expecting that. So like I said, I think it was very logical to want to have a birth out of the hospital, but still, I was surprised how unusual it was for my community, the people I was around, and almost a stigma from it.
Okay. So I understand that, you're mentioning the sort of outcomes, which of course, are distressing. But what is and in the other column of like the atmosphere, whatever the sort of like the positives of being listened to, the things that sort of drive you to it. What were those things that were sort of seeming to attract you to it, outside of like that's bad or I'm scared
Yeah.
of that. I mean, hospitals have their, important roles. So in this moment, you're thinking, but I don't really need a hospital yet. So I think I want to go over here. So what was over here that was attracting you?
Yeah, so I also envisioned my birth as having a Black birthing team. So I was going to make sure I could get as close as I possibly could to that. And I didn't think it was going to be possible, and I was able to find Dr. Skanes, and that was a pleasant surprise for me. I wanted to make sure we talked a little bit earlier about the education that's needed on a collegiate level and different ways to start to continue the efforts to improve birthing outcomes. I think one overlooked that I really couldn't do without for my pregnancy was the people around me being educated about basic things. Having a doula, or doula Stacy, which you just saw, she was fantastic. She came by, every couple of months and like educated us about what was going to happen. She educated my partner on how to advocate for me, sharing that information with my community and my friends so they knew what to ask for, that I could even share them the experience of pregnancy and something different to people who may not know a lot of stuff they don't tell you about pregnancy. So I think educating those folks around us was really important to answer your question, having what I envisioned, which would be a community around me to support me and advocate for me before, during, and after the pregnancy.
Okay. Well, Dr. Skanes, you're the founder of Oasis Family Birthing Center, and you're also an OBGYN. So, you're sort of have these two things happening, both midwifery and the OBGYN and hospital. Can you tell us why you felt it was important to, ha offer these two things to your patients, or these two options?
Yes, so a couple of reasons. One of the reasons I was really intrigued by this is like my major was African American studies. So I've been a lover of African American history, and midwifery is inherent to African American history, it's inherent to Africanism. And I felt is it culturally important. And then I began to look at the evidence and I'm like, hey, look at all the data that supports birthing centers for low risk women. I'm like, this is something that could make a huge impact in our community, but specifically not just Alabama, but specifically in the Black community. So I really was interested in that. And then I had some midwifery students come to me before I started the birthing center, and they were talking about the fact that they had such a hard time finding a preceptor, that some of the white midwives in the community had specifically say, I don't take Black students. And so to find out, like, that was what, 2020, that people were still doing that. Like, this is something that I don't know, I feel is like culturally very much something that was owned by Black people. And to have people say, well, we're not going to help you in your journey of something that we took away from you, that was really devastating to me. So I'm like, okay, one of the main goals of the birthing center is to educate midwives and to create more Black midwives. And so when we bring on patients, of course, we want to educate the patients. We want everyone to feel like they get a good understanding of what's normal in pregnancy, what's not normal, but we're also providing education to students. And so we make sure that the patients know that, like, this is a goal of mine, is that we want more Black midwives in the community. Are you okay with having a student there in your visits, at the birth, as a part of your team? And I have never had anyone say no. Once they understand what's going on in the community, they're like, absolutely, we want more people like this in the community. So it's a lot of reasons. And the last reason being, change in the hospital is very, very slow. The evidence can be what it is today. It might take the hospital 20 years to change the protocols. And especially in a place like Alabama, where, I mean, everywhere hospitals are political, but Alabama is still very much an all boys club, and all it's very much like that. It's very hard to get a big change done. And so, kind of like I spoke about in the documentary, sometimes you have to create what you want to see. And I wanted to create something that we're going to go with the evidence, what it is right now. We're not going to wait years down the line. We're going to make a difference now.
Okay. Yes, I think I can certainly imagine that change is slow. So, Dr. Gillespie, you opened up the conversation about midwifery and how that could impact. Can you talk a little bit more about how it can help, um, you know, eradicate this sort of, or at least improve maternal outcomes, for Black women, and how it can sort of integrate with the system we already have.
I think there's a few things. We have a system, and our system is broken, so our system needs to be fixed. So that's one thing. And then, if even looking at it just from not even from a disparity standpoint, if we just look at the hard facts about the system, the data already shows that by 2030, we are going to be short 5,000 OBGYNs across the country, specifically 2,200 in the South. So, one, our system is broken. Two, our system is not sustainable. We already do not have enough physicians to meet the needs of our patients. So, we have to integrate midwives into care. That we have no other choice. We have no other choice. Not just from an outcome standpoint, but we have no other choice. We don't have enough physicians. And if we just think about it logically, I, as an OBGYN, I'm happy to take care of any patient that comes through my door. But at the same time, if I'm taking care of a low risk patient that is, for all intents and purposes, going to have a vaginal delivery, and we already know there's not enough of me, doesn't it make more sense for the midwife to take care of that low risk patient, which we already know by the data is going to have better outcomes if that patient is with the midwife instead of me? And now I'm available for that high risk patient who has hypertension and diabetes, and this is going to be her third C-section. So from just a supply and demand standpoint, we must change what we're doing with our healthcare system. And then specifically for Black outcomes, yes, midwives have more, one, they have better outcomes. And they also have more time. They have time to sit and to listen and to provide that patient-centered care. And quite frankly, we as physicians need to be learning from our midwives how to do that. We don't do enough of listening to our patients to understand what their goals are, what type of birth they want to have, what type of experience that they want to have. We in medicine think that we have a healthy baby, we have a healthy mom, boom, we did it. That's what we were supposed to do. And we completely forget about the experience. That's the bottom bar. Having a healthy mom and a healthy baby, okay, we're supposed to, that's the bottom bar. But it's also about the experience and how patients are treated, how they're centered, how they're provided respect. And the data just shows midwives are much better at doing that. And we, quite frankly, like I said, as physicians, we really need to learn from them.
Yes, thank you. I think that I'm going to now turn to you, Kai, because I think that this was important for you to have the experience, and I appreciate what you're saying, that it's not just about the final moment, the outcome of having the baby, but the whole, the birth itself. You know what I mean, as being an experience that one can actually, like, not just grit your teeth through, or fear. And so, Kai, I guess I'll return to you and talk and ask you about your experience. I mean, obviously you saw Dr. Skanes, but you also, had a relationship with your midwife. Can you talk about how the birth experience was for you?
Oh, okay. So I was very thankful that I had my team around me, and I couldn't imagine doing it again with them, without them. The experience was, it takes a lot for me to say this, but was what I expected. One of the things that really played into this is, yes, I want the odds in my favor, but am I willing to do it natural to have those odds in my favor to further my odds? And that was a lot of mental preparation. So I think people don't talk about that. Talking through beforehand what contractions you're going to be like. People always joke, they think I'm joking when I say this, but I tell them that me and my partner, maybe at least 3 times a night, we would say, okay, you ready to practice labor? And we would sit in the room and think, breathe through it, think about techniques, just really, just out, just one, can we do 1 hour straight? Just, all this breathing, doing, even when Stacey Ardula came over, she is taking us through what it's going to be like. So as challenging as those 36 hours were, I knew what I was getting into. And I think that's saying a lot because I can go into a hospital and not know what's happening, not know who I'm getting. So as much endurance as it took, it is what I expected. I'm very glad that I would do it again. I will do it again. I stand by my decision. And one of the things that was mentioned at the top of this conversation is, yes, there's a lot of fear that Black women have going into this, but I'm also excited to share those stories about different ways that things can be done and believing that other is possible and better is possible. So by being in the film, the big thing that was, it's easy to say now, but back when I was pregnant, I would say, I hope and pray that I'm a positive story to be shared, and that's what's at stake, being a positive data point that can be seen. And as much as this is going to be a challenge to do this film in such a state, I'm really happy that I could lend my efforts into that direction.
Well, that's great. And I think we're just going to conclude our panel by maybe showing a couple pictures of this baby that we saw being born. Now, is he a year old? Is that right?
We just turned a year old, which is
It's
crazy to
crazy.
think.
So,
So,
so sweet.
yeah.
And there's your partner and your adorable family. So thank you for
Yeah.
sharing.
No, thank you.
So now I believe we're going to open up for a few Q&As, which I will have to check the Q&A box to see what they are. Okay, let's see. We have one who says, okay, says, can you all talk about the way that Black people have been instrumental in the science of medicine and how that's sometimes not being talked about right now? I think she also mentioned, or the questioner also mentions somebody who introduced the West to inoculation, I guess with the smallpox vaccine, or that West African midwives were doing safe and successful C-sections before colonization. Will any of you be able to speak to that?
Well, yeah, I think they pretty much answered it. I think that we are definitely not educated on the fact that a lot of these things did begin in Africa before even coming over here, midwifery, C-sections, vaccines, even some, herbal remedies and things like that. And I think that a lot of times when you're reading, especially in the older medical textbooks, it's just like so dreary about like Black people, like everything is like the Black people are going to have the worst in this, the worst in this. No, there's very little effort to talk about all of the things that were positive that Black people have brought to medicine. But I think the documentary does a good job on highlighting the fact that we have bore the burden of a lot of experimentation without receiving the benefit of it, especially here in Alabama, the birth of gynecology, the Tuskegee experiment. There are other experiments that still they do now, when we bear the weight of them. Of those experimentations without getting the benefit. One of the things that people don't talk a lot about with Marion Sims is the fact that all of these surgeries that he did in Alabama on these women multiple times without anesthesia, he left Alabama once he got what he wanted out of these women and went up north to make money from white women. So the people, the enslaved women and the Black women in Alabama did not reap the benefit of his quote unquote expertise once he, developed the technique that he developed. And I think that's something that we see often in experimentation that is done on Black bodies.
Okay, I think that we've mentioned Dr. Sims a couple of times, and I think that I don't know if Dr. Gillespie, you feel like if you could sum up his who he was and why we mention him.
Sure. So, Dr. Sims was known in my book as the father of modern gynecology. He invented the vaginal speculum. He invented the procedure that repairs vesicovaginal fistulas. But he did all this by operating on and I would actually say slave girls, slave women, because they were young. They think the average age was about 15 years old. Three of that we know of in particular, Anarcha, Betsy, and Lucy. Anarcha, we know that he did over 30 surgeries on her over a 5-year time frame. These were women who had fistulas, who their slave owners basically leased them out to Marion Sims to experiment on, and he operated on them without anesthesia, even though anesthesia was available at the time. And what got perpetuated is that these women had super bodies, and that's where it got perpetuated. Well, black women don't feel pain in the same way, and actually that was put into textbooks, and it became part of the education in medical school. And then as it was shown in the film, when the study was done at the University of Virginia in 2016, they asked 222 white medical students and white residents how about black people in pain. And over 50% of them said that they felt that black people have thicker skin, they have different nerve endings, and they don't feel pain in the same way. And really that came from what the experiments that Marion Sims did, combined with Samuel Cartwright and some others that were mentioned in the film, that made that tried to describe race as a biological condition.
And I think studies also show that Black women uh, receive less pain medication. I mean, pregnant Black women receive less pain medication. Um,
That's
um,
correct.
yeah. So, so another question from our audience is that the person is mentioning that outside of pregnancy, Blacks have high rates of diabetes, obesity, and consequently high mortality and a shorter life expectancy compared to whites in general. So the question is to isolate maternal morbidity and mortality from general disparities in health outcomes across the board. They're wondering uh, how they're worried they're concerned about missing the bigger problem if we talk about it in a subset.
Yeah, I think that's important to, if you're starting at a lower baseline, with more chronic conditions to begin with, then yes, you're going to have worse maternal health outcomes. So that is, it's important to note. But I think that it still comes down to bias. A lot of times when I see people, like, let's say they're not pregnant, just your regular GYN visit, and they come in and they have maybe diabetes or something like that, and I'll ask them, have you ever seen a nutritionist? No. If they have seen a nutritionist, oh, what did they tell you you should be eating? They didn't tell me anything. So are we getting the appropriate referrals? Are we getting the appropriate education to manage pre-diabetes, even before it becomes diabetes? When you get the new diagnosis of diabetes, are you being told what medications that you are to take, why you're taking the medicines, why it's important to take these medicines? Are we being given the information to progress to being off of medications? Same with high blood pressure. I have seen a number of people come in and say, yeah, they said my blood pressure was high. Well, did they give you any medicine? No. They just told me to make lifestyle changes. Okay, well, what did they tell you? What lifestyle changes they tell you to make? I don't know. They didn't really specify. So that level of, it's almost like we're speaking two different languages, as the patient and as the provider of what information is being shared, and what understanding patients are getting regarding their health. I think that has a huge role in the outcomes that we have outside of
And
pregnancy.
And I think as the person was writing into the question, you're right. The disparities exist across the board. I wrote an article in our professional journal for the American College of Obstetricians and Gynecologists called "The Contrast of Color," because I got so upset when COVID-19 happened and Black people were dying at a higher rate, and everybody was going, what's happening? Why are Black people dying at a higher rate? And I was like, I've been saying this for years. This is the same reason Black women are dying at a higher rate. Structural racism and implicit bias. So, yes, we are talking about the disparities in maternal outcomes, but like I said in the beginning, we could take out maternal disparities, we could put in hypertension. We could take out hypertension, we could put in diabetes. We could take out diabetes, we could put in cancer. The disparities are just one of the outcomes. The processes for why we have the disparities are the same. So this is just another example. But again, implicit bias, structural racism, that will always be the root at any of the health disparities.
And I think our last question, it was, as a community, how do we move forward to sort of continue to champion basically what you all just said, in terms of these disparities and addressing them, if it's maternal health or these other things that you mentioned, how do we as a community sort of support this important cause?
Yeah, well, one of the things that Dr. Bell touched on earlier was HBCUs. I think supporting HBCUs is incredibly important because while we're, are a very small percentage of the doctors, Black women and Black people, the majority of Black doctors do come from HBCUs. I think it's like 80%. And so supporting them when it comes down to legislation, when it comes down to fundraising, when it comes down to, all the efforts that they're trying to do to stay open is important. Of course, a lot right now, the buzzword is DEI. DEI is critical to having more variety in the types of doctors that we have. And once you take away those type of opportunities at these outside institutions, at primarily white institutions, that also means that you're going to have less doctors, less therapists, less speech pathologists, because those are what make an opportunity available for somebody like me. It creates a scholarship for you to be able to attend. It creates opportunities for people to become midwives. Those things are important. And I think sharing your experiences with your family are also important, positive and negative experiences. So like Kai mentioned, talking about the fact that there are options when it comes to birth, but even outside of birth, encouraging family members to get second opinions, encouraging them to go to the doctor with a list of questions, encouraging people to really take ownership over what is being told to them, what is happening with their body. Like, what is the diagnosis that you're giving me? If I was white, would that be the same diagnosis? Really being bold and asking these questions for our family members, advocating on every level in the healthcare setting, on the policy setting, in the education setting. These are all things that you can do to support the work.
I
Great.
want to add one small point in
Yes,
there is that
please.
I think that to also make a huge change is also, I love the efforts to extend the conversation past the pregnancy. I think one thing that's not talked about, improving health disparities is the care I received after I left the birthing center. As soon as, and even during, as soon as Kyra was born, he never left my side. He didn't get carried someplace else. He stayed with me for as long as possible. He stayed attached with the placenta for as long as possible. He got weighed, measured everything right in front of me. And the next day I immediately had home visits. I had check-ins from everything from mental health to physical health and everything in between. And I'm very thankful for that as well, that post care and having more conversations about that to, just champion different narratives so folks can start hearing what a new normal can sound like.
And the biggest advice or the biggest thing that I usually say in these type of conversations is understand the power of your vote. I've talked about structural racism, said that a couple of times. For those that are not familiar, that's just public policies that create structures that disenfranchise usually racial, ethnic minority groups. And so the way that we vote, and I mean from federal to local, will make decisions about different policies. You just saw with Dr. Skanes, midwives were outlawed in Alabama. That was through a vote. So you have to understand the people that you're voting for. Do they really represent what you represent? Right now, I will say that between 22 and 23, we did see maternal mortality improve in the United States. For the first time in 30 years, it improved from 21 to 22 and 22 to 23, which is great.
That is great.
It is great. However, it went up for Black women from 22 to 23, but
Right.
we're at least moving in the right direction. And one of the things that I think is a part of that is that Medicaid has been extended to 1 year postpartum in most states. We're at a time when Medicaid cuts, I don't care what anybody said, it's about to happen. And
Yeah.
so the way that we vote, those make those decisions about those public policies that then put us in a place where we're 6 steps behind before we even walk into the hospital. And so your vote is your power, and it is so important that you vote and understand that.
Well, thank you all for this, powerful panel and for participating in the film. So thank you, Dr. Gillispie-Bell. Thank you, Dr. Skanes. Thank you, Kai Frazier. And thank you, Nova and Firelight team, Michonne, Justin, and Patty. I encourage everybody who's watching, to watch Critical Condition, Health in Black America from Firelight Films. That's streaming on the Nova webpage on pbs.org, and you can see that in the chat. Also, please complete the brief audience survey. There's a link in the chat for that as well. So thank you again. I really appreciate it. And I think with that, we are all done.